Hello everyone. Happy Saturday. Dr. A here. It's a little bit later today for the daily updates. Just to give you guys a chance to sleep in. For it's not like we all have plans, right? But in any case, I did go out today. It's still very restricted here, but I had to go out today to restock our groceries. So I'd like to remind you that we've been at home since last Thursday. So not Thursday this week, but the Thursday prior. And I just had gone out on Tuesday or Wednesday, I believe, just to get some fresh fruit and produce, and then again today, just to restock and get some meat and eggs and some healthy things. Um, it's it's very it's shocking to see the city so empty. And when you get to the supermarket, there's a queue outside, and people are waiting for somebody else to come out before they are allowed in. There's a security guard. They make you sanitize your hands. They check you. They make you wear gloves once you go inside. And even the queue, the people standing in the queue, they're leaving a good 6 to 10 feet between one another. So that's 2 to 3 meters from one another. So the queues look ridiculously long, and it just takes a lot longer, right? Because even the checkout process and everything just takes longer. And thankfully, these measures are being taken. Unfortunately, they have been taken very late, in my opinion, here in Spain, and we're already hearing of a lot of families, a lot of people, especially elderly people, who they need to go to the hospital. Once they get there, they've been triaged and they're sent home because somebody else, somebody who's younger, somebody in their 40s needs that ventilator as well, and they just decide to give it to the younger person, to the person with a higher likelihood of survival. So that is the one part that all experts are worried about. As I said yesterday, most people, most of us, 99, 98% will not develop a serious disease that needs hospitalization, but it is the 1%, and we cannot just... Hello. Gotta remember to turn this off. But it is that 1% that is going to definitely need that, and we cannot all do it at the same time. That is the important thing. That is the shocking side that we have to be on the lookout for, and that's why we are all being asked to stay indoors, because even if we're healthy, we can spread it to somebody else, and that somebody else can be an elderly person, can be an immunocompromised patient, or somebody that suffers from it. Now, a lot of people have also been asking me about what should I do? How can I prevent this? And number one is avoid junk. Not because we're at home all day doesn't mean that we have to be eating junk all day and just snacking and cookies and crackers and sugar and sodas. Avoid it as much as possible. Try to eat as healthy as possible as you can, because that's going to keep you healthier. Try to move. There's a lot of home workouts. I've actually found something very interesting in my Headspace app. As you know, I'm a big user of meditation apps, so I use Muse to meditate. I use Headspace as well sometimes. So Headspace has just started adding some exercises, so some movement with mindfulness, and those are pretty cool. They're about 20 minutes. They're mostly kind of like yoga based exercises, so do something like that. Make yourself active. Do engage in mindfulness exercises. I believe, as a matter of fact, that if you're not a Headspace subscriber, they've opened up access to a lot of their different programs for these next few days. So make sure that you sign up for an account, download the app, and just use it for free for a couple of days. I want to share with you as well something very interesting, and it is a conversation that I had yesterday with Dr. Nathan Goodyear. And I'm still editing the video for our LinkedIn series, and let me just allow him to explain. And this is the first time that I'm actually doing this, so hopefully this will work out well.
My name is Dr. Nathan Goodyear. I'm the medical director here at an Oasis of Healing in Arizona. It's a integrative cancer healing clinic.
Now you're talking about vitamin C IV, obviously, because when you're talking about 24, 25 grams, in a single dose, it has to be IV. But what about these people who suspect having been in contact with somebody who has been diagnosed, as COVID positive, would it be recommended for them to start taking some sort of mega dose of oral vitamin C?
Yeah, I think that's a fantastic question, and I think the answer is yes. Now, you have to deal with some pharmacokinetic issues. So obviously, when you're dealing with oral vitamin C, as the gut epithelium encounters, more of that vitamin C, and as the vitamin C levels increase in the blood, the gut down regulates the absorption. So there's this intense counter regulation on the receptors in the gut versus with IV, you completely bypass it. But in a preventative strategy, doing high dose oral vitamin C, oh, absolutely. The issue there is to worry about, the diarrhea, the loose stools that you but absolutely as a preventative strategy, I mean, that's what I'm doing. It's what I got my family doing.
like like I was saying, I hope that transferred the audio across, and it's a video that we're still editing for our LinkedIn series. I'm actually editing this one myself because the guys who edit my videos are working on another interview that we want to start putting out to share this information with as many of you as possible, right? So what he means is that if you have access to good quality vitamin C, it's really not going to hurt for you to start taking some of these measures. Now, he talks about maybe half a gram to 1 gram 4 times a day, so every 6 hours via like orally. Just if you don't normally take it, start slow because it might cause certain GI distress. And the reason you don't take a big lump of, let's say, 3, 4, 5 grams at a time orally is, number one, because you're going to have that distress, and number two, because like he explained, is if there's a lot of vitamin C circulating in our body, our gut down regulates the absorption, so it will stop getting the vitamin C that is ready for it to be absorbed. It won't be absorbed if our vitamin C levels are very high. Now, vitamin C has been shown to help as an antioxidant and to help combat some of these viruses, and he's currently using it for his immunocompromised patients, so his cancer patients who are undergoing chemotherapy and who are undergoing all these different treatments that their immune system has been wiped out. He's using it there. So if you have access to that, you might want to consider that. If you have access and they're still open, and you can find some of these places that do IVs and Myers cocktails and things like that, make sure that you try to schedule something and get an IV drip with high dose vitamin C. He is actually recommending that people, when they are suspected of having been in contact with somebody who has COVID, who has tested COVID positive, even if they don't have symptoms, they should try it out. They should try high dosage, even 15, 20 grams on a very slow push, and just as prevention, and that's going to help mitigate the risks and the side effects. So that is it for today from my part. I'll do another update tomorrow, so if you have more questions, make sure to leave them below. I'll keep you guys posted on when we start publishing these interviews on LinkedIn. This is for a new series called Doctors of LinkedIn that we're putting out. And like I said, stay safe. If you don't have to go out, don't go out, and let's just take it easy and flatten the curve. Have a great rest of the weekend.